right, so let's get started. All right, so welcome everybody to the last event in our speaker series for the 2020-2021 school year. I'm very pleased to introduce William Arbour, who is a PhD student in the Department of Economics at the University of Toronto. And I mean, I guess in a second I'll hand it over to him. Just for those watching, I will say, obviously keep an eye on our Twitter, CCR_U of A, for things that are going on next year and in the summer. And we're launching sort of a summer podcast series on our YouTube channel, and it'll also be available on Apple Podcasts and Google Podcasts and Spotify. So keep an eye out for that. The first one is already out, featuring Dr. Temitope Oriola, talking about the Derek Chauvin verdict and the future of the jury system. That is up on our YouTube now, and it is very, very good. The interview done by our grad student, Ashley Cole. Yeah, so without further ado, let me hand it over to William.
Perfect. Thanks a lot for having me. I really appreciate your time. Thank you to Jeffrey who invited me here to present this paper called Can Recidivism Be Prevented from Behind Bars? Evidence from a Behavioral Program. Like you said, I am not a criminologist, I am an economist, and I just want to motivate my presence here a little just by talking about the economics of crime and what tools do economists bring to the table when studying crime. The first thing is that it's well documented that economic conditions can affect crime. For instance, we know that employment rate, minimum wage, and so on can affect crime itself and can also affect recidivism. The other thing is that in economics, we have developed a set of statistical tools to isolate causal effects. In economics, we are obsessed about these causal effects. And so what we do in the field of economics of crime is applying these tools to studying crime, criminal behavior, and so on. And it's really important to know about the causal effects of policies and reforms, because that's how we can know how to prevent, how to decrease crime. So in Quebec, now we are a group of economists studying crime. We established a few years ago a partnership with Quebec's Ministry of Public Security, following a report that was published in 2016. This report established some concerns about the ministry not knowing the results from their rehabilitation programs. So inmates in the provincial prisons of Quebec are offered a broad set of different programs to encourage their rehabilitation. But as of 2016, we still didn't know whether these programs were effective at preventing recidivism. So this brought us to this broad question: do prison-based programs prevent recidivism? And the truth is, we don't have a clear answer to this question. And this is true in Quebec, this is true in the entire country, in Canada, this is true in the US and also in Europe, okay? And I can think of a few reasons of why this literature has not found any precise answers. In fact, the quantitative research in this area is very scarce. The first reason might be that randomized controlled trials are challenging in prison settings. It can be challenging for security or anonymity reasons. Second, the data access is often quite limited. Some prisons, for example, won't even record participation to their programs. The third one is, in my opinion, the most difficult to solve, is this selection bias. Programs in Canada in general, within prisons, are voluntary. And so inmates decide whether to participate, and if they do participate, into which programs they want to get enrolled in. Okay, so this creates differences between participants and non-participants, and we cannot just naively compare both because they self-selected into the program. Let me just give you an overview of a selection bias with this very simple example. So let's consider a prison population. That's the general population, and they are characterized by their risk, say, to recidivate. So we have inmates in blue, green, who are low risk to recidivate, but we also have some inmates in orange or red that are very prone to recidivate. Okay, so this is our general population. So first case scenario is that participants on average are mostly low risk. Okay, in general, the blue and the green guys are those who participate. Now, what happens if we compare their recidivism rates with that from the prison population? Well, and these are fictive effective numbers, but we'll find that the programs are magical, like they reduce recidivism by this very high margin. But its conclusion would be false because this gap here, let's say around 20 percentage points, is driven by, yes, the treatment, the program, but also in the baseline risk that is very different in the prison population and in the participant group, okay? This is first case scenario. Second case scenario is if, on average, participants are mostly high risk. For instance, if it's known that programs can increase the likelihood of being granted parole, well, high-risk inmates could view participation as a little more than just a program. It might increase their probability to be granted parole later. But what happens if we compare their recidivism rate with that from the prison population? Well, we'll find that programs do not work at all, and even worse, they might increase their likelihood of recidivism. But again, this gap here of 10 percentage points is due to the baseline risk that is way different between these two groups. And so selection bias in prison setting is can be confusing. We don't even know in which direction the bias is. But the primary concern is that risk is unobserved and often unobservable to us researchers. And this holds even if inmates are assessed by a risk assessment tool. Let's say that each inmate has a risk score. Yeah, we have this risk score, but there are still many other variables that we do not observe, such as motivation, remorse, and so on. We don't even know the reason why they decided to participate. This is often not contained in this risk score. Risk is just one aspect of it, but there are many other variables that we do not observe, like I said. And so we cannot naively compare participants with non-participants because they are different on observable characteristics. That this is fine because we can control for that, but they are different on unobservable characteristics to us researchers. So this brings me to this paper and what I do to correct a selection bias. So in this paper, I study the effects of a program called Parkour, which is a French word for journey or path. And it is a behavioral program that suffered in the Quebec's provincial prison. So in Quebec, just like in the rest of Canada, if someone is sentenced to less than 2 years, they will be sent to a provincial prison. Whereas if the sentence is to exceed 2 years, they will be sent to a federal prison. So this program is implemented in the provincial prisons, inmates with sentences of less than 2 years. This program will target high-risk offenders who who lack accountability of action, because this will be the focal point of the program. They really want the participants to work on this, to think about the process of victimization, to think about the consequences of crimes. So this program is quite long compared to other programs. This is in total 24 hours of intervention with a probation agent. In addition to that, participants must do some homework after each session. This is a group-based program. Around 5 to 10 participants participate at the same time. They talk to each other, they interact to each other. And the goal here is really to start a process of reflection, thinking about criminal behavior, thinking about the criminal decision process, okay? And in total, there are 3 different modules. And like I said, it's really about reflecting on crime. It's not about acquiring skills to apply on the job market later, for instance, but it's really to prepare reentry, to prevent recidivism. And so in this paper, I'm wondering whether participation in this program can actually decrease the likelihood of recidivism, okay? And this program is entirely voluntary. People can decide whether to participate, okay? So this creates a selection bias, just like I was talking about before. So this is a map of the province of Quebec. The map is a bit stretched, but each circle is a provincial prison. There's the area of each circle is proportional to the capacity of each prison. And the circles that are in blue are where I was able to access the participation data. So for instance, the biggest prison in Montreal, the one in Quebec City or Sherbrooke are all in the sample. The large gray circle here is in Montreal. It's the only female-only prison in the province, but the data was not available here. So all the individuals in my final sample will be male inmates. So first thing first, without getting into anything more complicated, I just compare the raw recidivism rates between participants and non-participants. But keep in mind that there is this selection bias because the participants decided themselves not to participate, and non-participants decided themselves not to participate. So I just compare here the recidivism between these two groups after controlling for some variables, for example, the age or type of crime committed, and so on. So within 6 months following release, I find a differential of 6 percentage points in the recidivism rate, and this is highly significant. I find the same thing within 1 year upon release. I find again this difference of 6 percentage points in the recidivism between participants and non-participants. But I could increase this window again and again, and what I find is after 2 years, the effects seems to dissipate or to fade away. After 2 years, the recidivism rates of participants is equal to that of non-participants. But again, this is with the selection bias. So my next goal is to control for this selection. So I use the fact that in Quebec, inmates' risk and needs are assessed with the risk assessment tool called the LSCMI. It's a tool that was developed in Ontario. Now that's used across Canada, also in the US, and in some prisons in Europe as well. It's composed of 43 questions, which yield a score out of 43. A high score means a high risk to recidivate, while a low score means a low risk to recidivate. This program Parkour, will target people who have a score of 20 or more. Okay, so on average, participants have a higher risk than inmates from the prison, the general population in the prison. I won't use the score itself, but I'll use the identity of the probation agent who filled out this questionnaire. So at the onset of sentences, inmates are randomly matched with the probation agent who will fill out this questionnaire, and based on this, will recommend participation into different programs. In particular, they can recommend participation in Parkour. What I find in the data is that for similar inmates, some probation agents have a higher propensity to recommend the program than others. And I'm going to use this variation. And just to see how, let's work through this example here. So the general idea will be to use the agent's propensity to predict participation. So let's say that we have two identical inmates. Okay, they are like twin brothers, same observable, same unobservable characteristics. The first one is randomly matched with a probation agent who happens to always recommend the program. The second one is randomly matched with a probation agent who maybe doesn't know about the program and doesn't recommend it very often. So this creates this exogenous variation that I need. The first one decides to participate based on this match, but the second one does not participate. The point here is that I can compare these two people because before the match, they were the same characteristics. But I can compare now their recidivism rate because the only difference is that one participated and the other did not. Okay, so this is what I'm going to be doing. This is called an instrumental variable strategy, and I need two regressions to do that. The first one, in my first stage regression, I regressed the participation decision on the evaluator's participation rate. So like I said, I find the data that some evaluators have a very high participation rate, whereas others do not. And in my second stage, I'll regress recidivism, consider within different windows, and I'll regress that on the predicted participation of each inmate in my sample. And my coefficient here will be the causal effect of the program, okay? And so this brings me to the main results of this study. So first, I consider the probability to recidivate, and I do that with a varying time frame. So within 6 months, I find that participants have a lower recidivism rate by around 14 percentage points, which is really high. I found around the same thing after a year and even after 2 years. Okay, and this contrasts a lot with what I found before. When I just compared the raw recidivism rates, after 2 years, no effect at all. Here, I find this very strong effect because here I've corrected for the selection bias, okay? Now this was for the probability to recidivate. Next thing I'm looking at is on the number of reoffenses. So on the y-axis here, I present the treatment effect on the number of reoffenses. And I consider again different time frames. And what I find is pretty striking. I find that within 6 months following release, I have this large negative effect on recidivism. So this means that on average, participants will commit less offenses, less reoffenses than non-participants. Then I find no effect. But after 2 to 3 years, I find the opposite. I find that the program causes people to commit more reoffenses. Now, this is quite puzzling, but this coefficient here is the exact mirror of this one. So this means that recidivism is not totally prevented, but recidivism is actually delayed by several months, by around 2 to 3 years. So this is not really bad news, but it hints at perhaps continuity in treatment upon reentry might be key to ensure that these effects are permanent, because as of now, they don't seem to have a permanent effect on recidivism. I find that so far, the effect is high, significant in the short term. What I didn't tell you is that these regressions, these instrumental variable regressions, capture a local treatment effect and not an average treatment effect. And what I mean by that is that some inmates will always participate, regardless of the probation agent they are matched with. Some inmates will never participate, but some will, depending on the instrument. And we call these subpopulation the population of compliers. They are those who follow the evaluator's recommendation. So everything that I found previously is the effect on these compliers. So the next obvious question is, who is more likely to follow the evaluator's recommendation? And so I run some more analyses to find that age is actually a key predictor to predict compliance. So what this figure shows is the fraction of compliers for each age in my sample. And what I find is that young inmates are more likely to comply with the recommendation. This means that if we were to encourage their participation a little bit more, they would perhaps participate in the program. And this also speaks to the magnitude of the effect that I found before. The effect that I've identified are those on the compliers. If the compliers are young people, well, this is good news because they are the ones who are most at risk to recidivate. And this is well documented in the literature. I find no further evidence that participants are more likely to be granted parole, nor do I find any evidence of behavioral changes. For example, if they do come back to prison, if they do recidivate, well, I don't find a change in the type of crime committed, for instance. And on that, time is almost up, and I can conclude. I think what's really important to get from this is that selection in treatment must be taken into account in these type of studies. And this holds for this program Parkour, but also for other programs offered in any prison. really. For instance, if I don't consider selection in treatment, the selection bias for this very study, I find very tiny or even null effects. But in reality, once the bias is corrected, now I do find this strong effect, at least in the short term. And so I think I've shown that programs like Parkour can actually prevent recidivism or at least delay it by several months or years. But like I said, this is not totally bad news. It means that perhaps we might need to continue treatment upon reentry, because as of now, this is a program only available within prisons. But there are many questions that are open for research. For instance, who benefits the most from participating to these programs? I've shown that young inmates are those who comply with the recommendation. Doesn't mean that they are those who benefit the most. For instance, we still don't know whether women or indigenous inmates can benefit at all from a program like this, or for any program for this matter. And finally, the group composition might matter. Parkour, a program that I've been studying, targets high-risk individuals and will put high-risk inmates in a room together for 24 hours. So we might think there could be adverse peer effects going on. So I think finding what an optimal group composition is a very valuable avenue for future research. And on this, I want to thank you for your time. I'm happy to take questions and comments. This is work in progress, so I really appreciate all of that. Otherwise, my email is on screen if you want to reach out. Thanks a lot.
Okay, if you have any questions, yeah, Sandra, go ahead.
Yeah. Hi, William. Thank you so much for your talk. It was very interesting. We all do a lot of, or many of us do research in prison, so it's particularly interesting to us. So thank you. One of your conclusions says, future research has to look into group composition. And I understand that. My question is, what would you say about research into who actually runs these programs, and does that matter? And the reason I'm asking this is when we're thinking about counseling, for example, there's a lot of research that says it doesn't really matter so much what type of counseling someone is doing, for example, psychoanalytical or more conversation-based or behavioral, etc. What matters more is the counselor itself. So, I mean, is that a factor that you've considered in terms of these recidivism programs? Is that something to look into, or is it really more about the program itself? Thank you.
That's very interesting. So no, I haven't looked particularly at who was the counselor. I think this is very interesting. What I can say right now is that this program is across the province, and each prison is responsible for actually giving the program. So a lot of different counselors are in this study. So it would seem that it's actually the program working, the content of the program working. But still, I could look at that. I could look within a prison if different counselors have different effects. I think this is very interesting. Thank you.
Go for it, Kevin.
I'll go. I was just commenting Sandra's orange shirt is much brighter than my orange shirt. But thanks for that. That's interesting. I don't do recidivism research for a couple of reasons. One is which I'm mathematically illiterate. But the other one is that I always stumble and I get hung up on operationalizing concepts. So for you, is recidivism essentially rearrest? Is that what recidivism is here?
Recidivism here, I didn't get into details. I agree with you. It's very complicated. There's no consensus on what to do. Here, it's another sentence. So it has to go further than a rearrest. It's another sentence linked to another crime. Right. So you re-enter the criminal justice system later in life for another crime.
Right. Do people, again, this is not my area, do people, this would be a much different, much larger project, but do people do studies where they then try and do a follow-up in terms of like a survey of people who've been released in terms of their pattern of criminal behavior afterwards, which would get at more something like recidivism as opposed to re-engagement with the system. Is that a style of research?
I think so. About participation in programs, I'm not sure if I've seen anything like that. If anyone knows about it, I'd be happy to read that. Yeah, this could be possible. The thing is, we would have to do that for participants, but also for non-participants.
Yeah.
We need a control group. So how to operationalize all of this, I think would be complicated.
No, it would be a very big and very different type of thing. But yeah, it would get at a different kind of issue around recidivism.
Yes. So yeah. So here, recidivism is really another sentence. What we are really interested in is another crime being committed. If a crime is not being reported, I don't observe it.
Yeah. I have other questions, but maybe I'll just reserve them for other folks. So thank you.
Thank you.
Anybody else? The floor is open. So far, no questions on YouTube. We got about 12 people watching, but the chat is quiet. So if anyone has questions on YouTube, do type them into the chat and I will read them out. But if anyone else in the Zoom here would like to ask a question. Oh, I see Ashley has a question. Go ahead, Ashley.
Hi, thanks so much for the talk, William. I just had a quick question. I was wondering if you controlled or were able to consider rates of contact with correctional facilities. So how many times have they been incarcerated prior to their potential participation in this program? If that was something that was considered. And then my second question is, if you were able to consider, I think Kevin kind of spoke to this, considering re-entry conditions. So did they have access to, like, I don't know how much information you had about them, but access to work, housing, social supports on re-entry, or I guess on maybe more of a quant perspective, did you have access to information about re-entry supports across the different institutions that you included?
No, these are very good questions. So the first one, yes, I do control for criminal history. I will control for the number of prior convictions, for instance. So I control for that. I control for family members, number of dependents, and so on. So all the usual characteristics, I do control for that. I do not control or I do not look at re-entry conditions. I find no effect on parole, but it's just not significant. Maybe there's something there. I don't have the statistical power to detect this effect. I'm actually working on a project right now on the effect of parole with a similar design, but no. So this is an average. I would say it's an average effect. So we know that this program works on average. Maybe it's better if, for instance, re-entry conditions are imposed. Maybe so it's really an average of every possibility of re-entry. Thank you.
Okay, I have a question here from L'Oreal on YouTube. So she says, thanks for that, William. What were the full set of variables, in quotation marks, that you were controlling for looking at recidivism? For example, job opportunities, family support, stable housing, etc. That is, how can you be sure that the content of the program reduces recidivism for a period of time and not other outside factors?
It's true. I don't really know about the mechanisms that help inmates not to recidivate. That's entirely true. This is work in progress, and I want to look at, for instance, social welfare, reliance, job opportunities, and so on. So I know that recidivism decreased. I don't know the mechanisms by which it does. It could be because they have more job opportunities. Maybe they are better in interviews, for instance. But I do not know that. Thank you for the question.
Go ahead, Justin.
I think Justin has a question.
Hello, can you hear me?
Yeah.
Okay, yeah. Thanks, William, for the talk. I just had a question. I'm not sure if you mentioned this or not, but how old is the program, and has it changed? Do you know if it's changed much since it first began? And I guess that's the kind of the first part. And then the other part I'm just kind of interested in is, does the institution or institutions, do they evaluate this program and then make changes, or do you know anything about that? So I guess these are kind of interrelated questions.
Yeah, good question. So the program was implemented in 2007. There was a rollout operation at first. So at first it was very low scale. So only a few hundred inmates participated at this point. They evaluated the program internally and they did some changes. I think the final version is from 2009. So from 2009 to 2018, where my sample steps, it's the very same program, the same content. The program is being evaluated by the ministry, but not with regard to recidivism. For instance, they can interview counselors who have given the program, but to know whether recidivism is affected, you need macro data. You need to have more data. You need to see everything. So actually, I think this is the first study studying a program like this, at least in Quebec, with regard to recidivism.
Great, thank you.
Thanks.
All right, I got another one from YouTube here. This one from Celine. Thanks for your talk, Will. You talked about the local effect of your results. So I'm curious if you have considered applying your method to other programs, either in Quebec or in other provinces.
Yes, it's true. So here it's local, not just because it's in Quebec, but it's for individuals at the margin. People who will participate if they are recommended to do so, but will not participate if they are not recommended. So I think this is interesting. This effect is interesting because it answers the question, what if we were to encourage people into treatment a little bit more? People at the margin, do we want them in the program or not? So this is what I'm identifying. Now, this method could be applied to any programs in Quebec, and I've done that with co-authors as well. It could be applied for any other program, really. But you need something that affects participation exogenously. It's not to the inmates themselves to participate or not. You need some random variation to apply this kind of method.
Okay, perfect. If anyone else has questions, just yeah, Kevin, fire away.
I do. I mean, the first a comment and then a question. I guess the comment, I find it interesting that the crimes that they're reincarcerated for are sounds like they're roughly the same types of behaviors that they were originally incarcerated for. Yeah, I just found that interesting because there's a lot of variability here. I guess my question is, to what extent or is it possible to tease out whether what's going on here, what's being measured, is personal motivation to change? Because that seems to be something for a subset of people. No matter what, after prison, there's some motivation to change, which then kind of declines over time. So is it possible to tease that out, or is that something that's part of the framework?
No, that's very interesting. I think actually one of the module is motivation to change. So you are totally right. So it seems like there's something going on in the short term that really works. Now, for instance, this program is in 3 modules. Now, to detect which module or which content really works, we need an extreme amount of data to know that. The thing is, people can stop the program if they want to stop. So the decision to stop the program is not random. So this creates another selection bias. So here, I consider people who completed at least the 2 first modules. But I totally agree with you. To know which content is really beneficial would be key to understand the mechanisms. Here, I know that something is going on. I cannot tell more than that.
Okay, good. Thank you.
Okay, so I think this question is in the same vein from Nicole on YouTube here. She says, thank you so much for this super interesting talk. I wonder if you included people who did not complete but registered for the program.
Some of them, yeah, I do include them. I show in the paper that if I remove them, it doesn't change the results. So no, that's a very important question. But actually people have to participate and they have to complete at least 2 modules out of 3. If they just register and don't participate, they're not included.
All right, anybody else? I mean, you don't have to raise your hands if you just want to ask questions. Go ahead. Okay, we probably have time, I think, for 1 or 2 more questions overall here. Oh, L'Oreal has another one here. Okay, 1 more question. If the Parkour program itself targets high-risk offenders, then why is it important to control for the selection bias of risk when looking at recidivism?
That's a very good question. So I could not deal with the selection bias. And because I know the sense of the direction here, if you remember, I find effects in the short term, right? Within 6 months, within a year, I find a differential of 5 percentage points. And because I know that selection is on average negative, I can interpret these treatment effects as upper bounds in absolute values. Now, the problem is if I increase this time window, I don't find any effect. So selection is so negative that it cancels out the effect. So if I were just to do that, my conclusion would be that the program does not work. The effects are very tiny and then doesn't work at all. But when I correct the selection bias, then I found strong effects. But it's true that I can still say something about the original results that do not control for selection.
Okay, perfect. All right. I guess 1 last question, if anyone has something they want to ask William, and then we'll conclude from there.
Hi, William. Thank you for your talk. I was just going to ask really quickly if you can maybe speculate on your results as to why the program seems to be. I guess maybe you may have talked about this before in your response to one of the other questions, but can you maybe shed more details on this program, what it is, and what is unique about it?
Yeah, totally. So compared to all of the other programs in Quebec, this program is the only one who's implemented across the province. Usually, prisons will manage and be responsible for their own programs. This one is very peculiar in this sense. It was developed over a few months, a few years by a criminologist at the University of Montreal. And it's the only program, to my knowledge, that was implemented this way, that was thought about like for a few years and was thoroughly developed. And it's based on criminology theory. Now, what this program does is really about reflecting about the criminal decision process, analyzing the consequences, the cost of the crime, and so on. We really want the participants to engage into this process of reflection before they commit another crime, perhaps in the future. That's really the focus of this program.
And just one more quickly, who develops the program? Who's involved in the development of it?
So at first, it's Professor Denis Lafortune at University of Montreal. Then all the counselors are trained to administer to give this program. Usually, they are probation agents with a degree in either social services or criminology, but they are trained to give this program.
Okay, thank you.
All right, I guess we will. That's a good place to end it. So I will shut off the YouTube stream here in a moment. But I just wanted to say a huge thank you to William for a really interesting talk and for closing out our speaker series for the year. And hopefully, you'll join us next year as a guest and watch some of our talks, or maybe we'll have you back if if you have another paper you want to talk about, we can think about that too. But yeah, thanks so much everyone for coming, and thank you so much for awesome speaker series this year. And we look forward to coming back in the fall with new speakers. And yeah, keep an eye on our YouTube channel for videos coming through the summer. We have some podcast discussions on a whole bunch of criminology topics. The next one coming out, like I said, we had one from Dr. Oriola on the Derek Chauvin verdict, and we have another one coming in a few weeks from Justin Pichet at University of Ottawa, talking about the effects of COVID on imprisonment and his work at in decarceration in the Ottawa area.